Hi everyone, can you hear me, everybody?
Yeah.
Per-
Yes.
Yes.
Perfect. Right. So I'll request you to mute your mics, please. What we'll be doing is we'll be going through this slideshow, which you can see on your screens. And then, if you have any questions, you can keep it till the end of this, till we finish, and then you can ask those questions, and we try to answer as many as we can. Rest after that, you can you know, if you have further inquiries, you can call our office numbers, right? So yeah, so today's topic, as you all know, is nursing as a career and options for PR through nursing. Like, how can we get permanent residency through nursing, and then how good is nursing as a career? So let's start with this one. Okay, so how is nursing, like, what is a nurse? So the healthcare sector is one of the Australia's largest and fastest growing industry, and the nurses account for 30% of the healthcare jobs postings. So all the advertised jobs for the health profession. I would request you to please mute your mics. Thank you. Yes. Yes, and nursing in Australia faces a severe shortage, and the employers are always struggling to get a suitable candidate for their company. So in 2014 report of the Department of Health, they projected that there would be a shortfall of 85,000 nurses by 2025, and which will increase to 1,23,000 by the year 2030. So as you can see from this, that nursing would be a very good profession to be in the future, to get a permanent residency, of course, and also to get a job in this in nursing. So how to be a nurse? So there are two educations which you can enroll into to be a nurse. So first of all, you can do a diploma in nursing, which will lead to uh, occupation of enrolled nurse, or you can do a bachelor's degree which can lead to a registered nurse. So graduates from other professions, if like you are a graduate from any other profession, can still be eligible to do nursing. You can do a master's course or a graduate course, and it can be shortened to a 2-year degree instead of a 3-year degree as a graduate. And master degree, if you are doing a graduate entry, it's a 2 years course. For the IELTS and PTE course, you need equivalent of 7 in each to get an admission. In diploma, it can be that you can get admission in, if you have a band score of less than 7 in any, but overall you still need to be a 7 in IELTS or PTE to get a admission in diploma. So AFRA and NMEC. So what are they? AFRA is an Australian Health Practitioner Regulation Authority, and all health professionals fall under AFRA. So it's like a big body which governs all the health practitioners in Australia. And you need to be you need a registration with AFRA for practicing nursing, and then the governing body or the assessment body for migration assessment is NMEC for nurses, or you can call it Australian Nursing and Midwifery Accreditation Council. To file an application for migration purposes, you need both NMEC and AFRA registration. NMEC assessment and AFRA registration. Uh, that's a compulsory to if you are applying for a 491 or 190 or 189 application after this. So options for studies. What options do you have to study nursing? Make sure that your courses are accredited by AFRA. So whatever course you do, make sure that it's accredited by AFRA. So the courses which are not accredited by AFRA, um, you need to do procedure. You need to go through a procedure like the exams and or anything to get yourself registered. So you don't want to do that, because that will delay your process. So it is always better that you take an admission in a course which is accredited by AFRA. Now we'll discuss the options. State wise, we'll discuss few states, that how you can get a permanent residency through those state sponsorships. So first of all, let's start with Victoria. So for Victoria, if you are a registered nurse and you are graduated from anywhere in Australia, that's important that you can apply for a state sponsorship 190 assessment for Victoria, even if you are graduated from any other state. You need a AFRA registration and an NMEC assessment. And as I said, you may be living anywhere in Australia, and you are eligible for applying for a 190. The minimum point score is 60. We have seen that the invitations coming at minimum point score, which is 60. So 5 is given by the state of Victoria, and then 60 is your own points, and then you can apply for Victoria nomination. Other than that, if you don't have that 60 points, if you have a less point score like a 50 at least, then you can apply for a 491. But for that, you need a job offer from a regional area. And options for the enrolled nurse in Victoria is only 491. So Victoria doesn't sponsor you or give you an invitation if you are an enrolled nurse. It's only when you are a registered nurse they can give you an 190. But you can definitely get a 491 for which you need a job offer from a regional area. So options for New South Wales. So mind you that these programs like the New South Wales has not opened yet for the onshore candidates, but they will be opening soon. So for 190 is only open for is only there for registered nurse. Even if it is it will open in like which we are hoping like after July or something like that. So they will open it only for registered nurse. So you must be residing in New South Wales for at least 6 months, and there is no additional requirement for nurses in 190. So you can be graduated from Australia from anywhere, but you should be residing in New South Wales for the last 6 months. Then you can apply for a 190 state nomination of New South Wales. But of course, you need to do have that 60 points. So 5 is given by the state, and minimum you get 65, and then you can apply for a state nomination. For 491 options for RN in EN both, you should be working in your field for at least 12 months in a regional New South Wales area. Must also be living in regional for the same time, or you have completed a study in nominated field from the regional area of New South Wales within the last 12 months. So the study should be in your nominated field if you want to apply for a 491 visa of New South Wales, and that study should be from the regional area. So 491 options are for people who have less point scores, like they have a 50, not more than 50 point score. So they can apply for a for 491 visa. So for Northern Territory, Northern Territory, if you want to apply for a 190 application as a nurse for Northern Territory, you should be living and working in Northern Territory for at least 2 years, and you have worked in a nominated field. So you should be working in the nominated field for the last 2 years in Northern Territory, and you can get a 190. You can be graduated from anywhere in Australia. And the second option is that you can apply for a 491. You must be studying in Northern Territory for 2 years, or you must have been an Australian graduate and working in Northern Territory for 6 months in your nominated field. So that is as a nurse. Uh, then there is the other state, which is South Australia. For the South Australia, for the 491, you should be graduated from South Australia and working for at least 3 months in the field. And if you are graduated from the state, then you must be working for 6 months in the field in South Australia. So if you are a graduate from any other state, you have not graduated from uh, South Australia, you should be working in South Australia as a nurse for 6 months. So applications for both RN and EN are open. So you can apply for this if you fall under that category. Okay, and then the next is more good things about nursing. The nominations come at the minimum point score in nursing. As the trend, like in before, like we have seen in the invitations round and even the state nominations, etc., that you should meet the minimum criteria. So it's not um, true for other occupations, but it is true for nursing right now. If you want to apply for 190 for almost every state, the nominations are coming at 65 points. So 60 plus 5 of the state will give you um, nomination for 190. And for 491, you need to have your 50 points, and then 15 are given by the state, and you can get a nomination. Then the pay rate of nursing is very good, so it's a lucrative career, and there is plenty of room for career progression into nursing managers or facility managers. So you can have a good career if you start with nursing. So what we are doing for you. So we are doing free IELTS or PT classes for you. We are doing free student visa for you. We are uh, giving you free migration advice and discount on scholarship and admissions if you want to enroll into any of those courses or any other course if you want to enroll into. We have offices in Melbourne, Sydney, and South Australia. If you want, we can meet you in person in those offices. You can come to us and we can help you out with all those. Or you can note down our number, which is 0396631318, and we can give you a free advice over the phone, or you can book an appointment and to discuss your all migration needs. So now, if you have any questions, if anybody has any questions, so they can ask us, and we can try to answer that. And but be alert that whatever we are discussing today or whatever we have discussed today is the generic information. So it may or may not be suitable for your particular case, like your particular needs. But if you have any particular question, you can always contact us regarding that. So if you have any questions, we can answer that. You can.
Hi.
Yes, please.
So my question is there any requirements from the Canberra of Nursing for nursing?
Yes, Canberra's requirement are still the kind of the same. Canberra works on a different metric, so that's why we haven't discussed this one in this, because it's a generic session. Canberra has a different metric, so it works differently than the then the Home Affairs Department or the Department of Migration. You need to qualify the metrics first. So to qualify, you need at least 70 to 75 on their metrics. You need to score on their metrics 70 to 75 points. Then again, you need to have at least 60 points on the Home Affairs point list, and then you can get qualified for that. If you want to discuss that, you can call us and we can do it over the phone for you. Otherwise, you can come to our office and we can discuss it more.
Okay, thank you.
Right. Thank you.
Hi.
Yes, Thalini.
Yes. What about the internationally qualified nurses?
So for international qualified, actually this session was just for the nurses who have qualified from Australia. If you are
Okay.
international qualified nurses, you need to have some point score like which is more than this one, because the states only give invitation to the people who have studied in Australia at minimum points. So if you are looking into if you are qualified from overseas and you have registration because of your non-Australian qualification, then you are looking at, in today's scenario, at least to like 85 to 90 points you are looking into to get an invitation. The point system, as you all know, in today's scenario, it's too high. It may go down in the future, but yes, right now it's this the case. Otherwise, what you can do is you can enroll into a course which is accredited by AFRA in Australia, and then you can get your degree from Australia, and you can, you know, hope for the state sponsorship on that, on the minimum point score. But if you
If
are
yeah,
qualified,
yeah, I
yes,
already have done a Masters of Public Health. So
yes,
it's helps for that, no?
Masters of Public Health, unfortunately, it doesn't get you anywhere.
Okay.
Yeah, yeah. So
All
it's
right.
more,
Thank you.
of for nursing managers. But
Mhm.
then for nursing managers, you need to have some experience to get a job, which is quite difficult. Yeah, but you can call us and we can discuss your case. I have few options for you, which we can discuss over the phone.
All right. Thank you so much for that.
No issues.
Hi.
Yes, yes,
I have a question regarding registration for AFRA.
yeah.
So how long does it take to get the registration?
From AFRA, it doesn't take long. Like if is your degree like accredited from AFRA already or not?
I'm not doing nursing, but I'm planning to do nursing.
It takes around 4 to 6 weeks to get the registration.
And what about assessment from NMAC?
Us NMAC assessment comes in like 3 weeks time normally. Yeah, but yeah, every case is different, so it may take long or short, but that's the average time.
All right. Thank you.
Thank you. And also, the guys, the best thing about nursing is that even if like you have been exhausted by your 485, you have already used your 485 temporary residency. For nursing, with nursing, you don't need do any professional year, or you don't need to do any of the job ready programs, etc. You just straight away get your registration done and then apply for your state sponsorship or 189, whatever you qualify for.
I have one more question.
Yeah.
If someone do nursing in their TR,
Hmm.
so I mean mainly diploma of nursing, or can they get the PR in 2 years, or I mean, or does it need extra time because TR is usually 2 years?
Yeah, so if you can finish your course in within 2 years time,
Mm-hmm.
in your TR, that's also good. You can be qualified for getting a state sponsorship depending upon the criteria of the state.
Okay. And what about graduate entry course? Um, if someone get entry into that, so it will be 2 years, right?
Yeah, so if you already have a graduation, like at least like 3 years of graduation, you can directly get into a course which can get you nursing graduation in 2 years time. But there are not many universities which provide that. There are few universities which can provide that. So yeah, you need to choose.
So which one is best, diploma of nursing or graduate entry?
See, 49. If your aim is 491, then then diploma is also good. Otherwise, you need to do a degree. Was that your question?
Uh, I just want to know which one is better because graduate entry is similar to bachelor's of nursing, right?
Yes, yes. Graduate entry is similar to bachelor's.
Okay, so my
Some universities also have masters, which is accredited by AFRA. But
mhm.
most of the universities have graduation only because you need to do a bachelor's to be a nurse. The accreditation is only for the bachelor's, but few universities do have master's course which are accredited by AFRA.
Okay.
Hello, can I ask a question?
Yes, please.
Um, I'm already finished. I just finished EPQRN,
Sorry,
and I'm about to
sorry, I
finish
can't hear
my.
you. Sorry.
Hello, good afternoon.
Yes, hi.
Yeah. I just finished my EPQRN, the bridging program for international qualified registered
Yeah,
nurses,
yeah.
and I am currently enrolled in an private college, and
Hmm.
my visa will expire this June 6th.
Yeah,
So I am planning to go to regional area.
yeah.
What do you recommend?
From which state are you?
I'm here in New South Wales as of the moment, and I am thinking if I am pursuing my career as a registered nurse in Tasmania or in Queensland.
Okay, so do you have a valid visa to stay in Australia, like now, or like I mean to
Yes,
say in future?
my visa will about to expire on 6th of June this year.
Okay, so first of all, you need to do something about your visa.
Yeah.
Other option can be that you get a, if you can get a, as we discussed, get a job offer from a regional Victorian company as a nurse. You can apply for the sponsorship from Victoria. Secondly, if you have worked as a nurse for 6 months in regional New South Wales, then also you can become eligible.
Oh, okay.
Yeah, first you need to do something about your visa because you need a extension for that visa to stay here, right?
Yes.
Yeah, yeah,
May I ask about the 408 visa?
yeah. Yes, you can call our office because we are not discussing 408 in
Okay.
this session. You can call me. My number is 03966631318, and we can answer all your queries about 408.
Can
Yeah,
you please repeat it again? 09?
is 03
Okay.
9663
Okay.
1318,
All right then.
right?
Yep.
Yeah.
And your name, sir?
My name is Baljeet.
Okay.
Thank you so much.
Thank you. Yeah, so guys, we are like towards the end of this session now. If you have more queries, you can always call us. Otherwise, you can visit also our offices, which are in Queensland, New South Wales, Sydney, Queensland, Melbourne. So yeah, so anything else you want to know, you can call us on number which is 03966631318. Thanks for now.
Thank you.